Hello and welcome to Friday's edition of COVID-19. I'm Min Sun-hee. New cases of the virus here in Seoul have been hovering in the double digits every single day since the start of this month. Health authorities are thus calling for stringent hygiene practices at high-risk facilities, as well as proper management of visitor registration at all venues. We start today with the headlines for this Friday with our Kwon So-ah and Noaram. Welcome.
Hi.
Hi, Sunny.
So I hear the government has announced intentions to extend tougher measures in the Metropolitan region.
Yes, the stronger measures were implemented in Seoul and the surrounding Gyeonggi-do province, as well as the city of Incheon, on the back of flaring up cluster infections. And that was supposed to be in effect until June 14th, but now it looks like this has been extended to an indefinite period. Health Minister Bang Neung-hoo has made that announcement this morning, citing the need for continuous toughened measures in the greater Seoul area as coronavirus cases have not been going down in recent weeks. In fact, risks of infections have been on the rise due to recent clusters at religious facilities, door-to-door businesses, indoor sports facilities, among others, that are leading to numerous chain transmissions. More than 96% of infections in the past 2 weeks stemmed from the metropolitan area. So under the extended measure, public facilities and entertainment establishments are asked to remain closed, with more planned to be designated as such. QR code visitor logs at internet cafes and cram schools are also planned to be implemented, in addition to tens of thousands of high-risk facilities where it's already mandatory. Minister Park said blocking the fast spread of chain transmissions, in fact, is also essential for students to continue to go to school following a successful phased reopening. And the minister also noted how tertiary and quaternary infections occur at the same time as when the first patient in a cluster case has been confirmed with COVID-19, stressing how fast these chain transmissions can occur.
Right now, I suppose that decision was inevitable since we are seeing a rise, I understand, on this Friday as well.
Yes, numbers do look concerning. According to the Korea Centers for Disease Control and Prevention, the average number of daily infections stood at 39.6 in the past 2 weeks, so almost 40. And this week, cases were mostly between the 40s and 50s, as you can see here. And with that, the total number of confirmed cases surpassed 12,000. As you can see on our next table, it's 12,003 total cases, and the death toll stands at 277, while 40 more people have been quarantined and 15 have recovered in the span of a day, which means it looks like there have been more hospitalizations than full recoveries.
Right. What is the situation looking like overseas?
Well, we have almost 7.6 million cases now. Let's take an overview by taking a look at our map. Now, 16 countries have more than 100,000 total cases, and we have some 3.3 million active cases, which means currently infected patients, and 4.2 million closed cases, which includes deaths and recoveries. And a quick look at this graph. The curve is still moving up quite steadily. More than 136,700 cases have been added in a day on Thursday. And on our list of majorly affected countries, there's been a change in India that surpassed Spain and the UK in the span of a day. And if cases spike at the current speed, that could be the case with Peru, that's approaching Italy's caseload now.
And I hear Russia, new cases there are rising at an alarming rate.
Yes, we also just saw it in our figures. The country surpassed 500,000 cases, following almost 8,800 new cases on Thursday. Now, according to Russia's health ministry, Thursday, a second wave of the coronavirus is possible in the country, attributing that chance to new imported cases from abroad, as well as climate factors that could have impacts on epidemiological research. On the same day, Russia rolled out a drug that's approved for treating COVID-19 patients, which have been and will be delivered to hospitals nationwide throughout the month of June.
Meanwhile, Tokyo is looking to lift its virus warning.
Yes, the Japanese capital is a step closer to a complete reopening of its economic and social activities. What was dubbed the Tokyo Alert that's been implemented on June 2nd will be lifted in 3 stages, including the lifting of operation hours of restaurants and pubs and entertainment facilities. Nightclubs will be allowed to reopen on June 19th. The ease comes on the back of stabilizing coronavirus figures. On Thursday, Tokyo reported 22 new infections, the day before 18. Japan also plans to allow some 250 foreigners a day to enter the country as part of its relaxing of travel restrictions.
All right, so thank you for that. I'll come back to you after the regular briefing.
All right.
Aram, the EU, it's looking to further open its borders from next month, I hear.
That's right. Brussels is calling on EU countries to open borders to travellers from outside the bloc from July 1st. Now, an EU official said international travel is key to tourism and business, which has been hit by the pandemic, as well as for families and friends reconnecting. Now, some European countries have started lifting internal border restrictions gradually, with a few others to follow suit around next Monday. But not all countries plan to reopen borders to EU travellers next week, with Spain and Portugal set to reopen later this week. Denmark only plans to open borders with Germany, Iceland and Norway. The European Commission is now asking member states to agree on a list of non-EU countries where travellers could come from starting next month. However, travellers from high-risk countries, including the US, are unlikely to be welcome at the outset.
Right, and we're seeing another positive assessment of lockdowns, this time from the WHO chief.
That's right. Tedros Adhanom Ghebreyesus said in a briefing on Thursday that lockdowns put in place in countries across the world was successful in slowing the spread of COVID-19. He added that some nations have been showing encouraging signs and have managed to avoid a mass crisis. Now, however, he warned that many are still vulnerable to the virus. He urged governments and citizens to exercise caution in order to stop any further spread. He especially called for strict management of large gatherings as social distancing measures starts to ease in some countries, including here in Korea. And he said that without strict management of safety measures, then a mass relapse would be inevitable. Therefore, he said measures including testing, treatment, development and contact tracing should continue at full capacity.
Right, and we're also seeing a slight shift in trend now. At the start of the pandemic, we saw a shortage of masks worldwide, and now we have a surplus.
Yeah, so France, for one, which would have been unthinkable a few weeks ago, is said to have some 40 million masks in surplus at the moment that have been unsold, causing concern for the textile industry. Now, this has prompted calls for consumers to purchase what they're calling French-made masks. At the peak of the outbreak in France, the demand for masks was so high that many textile companies switched to making reusable masks outside of their original forte. Now that cases are slowing down in Europe. The demand has obviously gone down, and French citizens have been opting for disposable surgical masks because they are lighter and more breathable, as well as cheaper as well. But the French government is urging the public to buy these made-in-France cloth masks because the surgical ones are less environmentally friendly and less economical. Now, officials say the cloth mask can be washed and reused 20 times, so over time it will work out to be cheaper than the surgical masks. And also, littering of surgical masks have become such a big problem in France that the government has now introduced fines for those who carelessly dispose of them. And Paris also wants to sustain the French production line in order to be ready for a possible second wave of COVID-19 or any other future health outbreak.
All right, Aram, thank you for that. We'll see you again on Monday. And again, it's a little after 2 in the afternoon here in Korea, just in time for the regular government briefing on the COVID-19 situation in this part of the world. Sporadic cluster infections centered in the metropolitan area are causing much concern among members of the public as well as health authorities. While most of these cases can be traced, a few remain untraceable, raising further alarm among officials as they seek to contain the latest surge in the number of domestic infections. Now, some observers are calling for the reintroduction of stringent social distancing measures, claiming that the cases of untraceable contagions are indications of higher numbers of the so-called silent spreaders. Health authorities, however, are not planning any immediate changes to the newly implemented daily life quarantine guidelines. They have nonetheless called for stringent hygiene practices at high-risk facilities, along with strict adherence to the QR code registration system. Meanwhile, as we continue to await the briefing, let's take a quick look at the daily life quarantine guidelines given out by the government, of course. Should you suspect that you may have been exposed to the virus, or should you feel unwell, do choose to stay at home for at least 3 to 4 days, and also to get tested, especially for those in Seoul, as the testing is now free and open to all. Remember to keep a healthy distance from those around you and to wear a face mask when outdoors, as a recent study proves that the chance of contagion dropped by 80% if you're wearing a mask. Here now is a briefing. We'll come back to you afterwards.
Let us begin our regular briefing for the COVID-19 response here in South Korea. As of June 12th, today, midnight, we have 56 new cases, and the total number of confirmed cases now stands at 12,003. 15 more people have been fully recovered, and a total of 88.9% have been discharged, and now 1,057 people are in quarantine undergoing treatment. We had one more fatality, and the death toll now stands at 277. The fatality rate is 2.31%. As of midnight today, we had 56 cases. Of them, 13 were imported cases, while 43 were local transmissions. Looking at the imported cases first, the countries, 2 were from America. Others included 5 from Pakistan, 3 from the Philippines, 1 from Indonesia, 1 from Kazakhstan, and 1 from Kuwait. And as of today, noon, we also have some updates to the domestic cases. At the Kupang Logistics Cluster Center in Bucheon City, Gyeonggi-do Province, 1 additional case has been confirmed, and a total of 147 cases have been confirmed to date. And related to the newly planted church in the Seoul metropolitan area, we have 1 more case. Now the total stands at 95. Ridgeway in Gangakgu District, Seoul City, we have additional 23 patients, and a total of 139 have been confirmed to date. We are also seeing new cluster infections that are related to Ridgeway, and about over 46% of them are aged over 60. And in relation to Ridgeway, we have some more updates. As you can see, there are also cases related to churches and centers of worship, and the secondary infections related to the business establishments, which amount to up to 99. And you can also see that the age range, we have the majority in the 40s, and people above the age of 60s stand at about 40%, 46%. And we see that there is a high proportion of the people in the senior age group. And in the Gyeonggi Gwangju City at a nursing hospital, we also have 1 additional case, and a total of 10 people have been confirmed to date. And today at the Seoul's Dobong-gu District Sangsim Daycare Center, we had first case of confirmed case, and we have additionally 2 additional staff members as well as users, and the total now stands at 14. And including the contacts and all of the users, we are conducting diagnostic testings for the 88 people. Out of them, aside from the 13 additional confirmed cases, the rest were tested negative, and we are still doing the contact tracing. And also in Gyeonggi-do Province, we have 4 new cases at a specific nursing hospital, and we are currently doing epidemiological investigation and contact tracing. And in Daegu, we found 1 confirmed case at a middle school, and we are conducting our epidemiological investigation and contact tracing. The KCDC has decided to make the following decision despite the intensified quarantine in the metropolitan area until the 14th 14th of June, we are seeing increase of the cluster infections. So until the situation stabilizes here in the metropolitan area, we will be extending our intensified live quarantine measures and putting a ban on mass gathering. And instead of having a specific due date of these extended measures, our aim is to stabilization of the cluster infections and to have an increase of daily cases of 1 digit. And we are also putting in place a mandatory QR code systems for multi-use facilities, including PC rooms and private academies. And we will also carry out extensive inspection for the multi-use facilities here in the metropolitan area. And for those that breach quarantine measures, we will have them be subject to grave and illegal circumstances. And we are seeing a stark increase in the number of confirmed cases during the weekend. So please be cautious. And we have found that lately cluster infections have been taking place at basement floors and places with poor ventilation. And these places were also involved with activities that increase the movement of droplets, the respiratory droplets. And also these were places where live quarantine measures were not kept, including wearing a face mask and distancing. And as for the weekend, as for the religious centers, we ask you to avoid small gatherings as well as the other activities that increase the risk of droplet infection, including chanting or singing or eating together. And if you need to have unavoidably physical service or physical gathering, we ask you to reduce the number of participants and please screen everyone for their body temperature and have all of the participants wear face masks and keep distancing. And please refrain from avoiding to eat together and involving in chanting as well as singing. As we see an increase in the number of patients among senior members, we are seeing a high proportion of patients with critical conditions. So as for the senior citizens, we ask you to refrain from any social gatherings that take place in an enclosed space with poor ventilation or have no windows. If such an occasion is unavoidable, sharing meals and singing should be avoided, masks should be worn, and frequent hand washing or sanitizing should be practiced at all times. Moreover, we ask you to take care of your chronic medical conditions. You need to also utilize various means of consulting with healthcare professionals on a regular basis, including over-the-phone consultations. And when you visit a hospital or clinic, wear your face masks. Regular exercise is also very important for the senior citizens, including light home exercise and stretching, as well as taking a stroll on a regular basis at places and times with less foot traffic outside. And recently, we have seen the cluster infections leading to high-risk facilities, including nursing hospitals, where a lot of people are vulnerable to the virus. And we also ask these hospitals to report if there are people with suspicious symptoms, and please get tested as soon as possible. And in order to block the infections from entering such a facility, we will be carrying out the diagnostic testings for any of the newly admitted patients, and their cost will be covered by the National Health Insurance. So please take use of the system. And all of the people, please remember that you could also increase the risk of infections if you visit these and if you go to these nursing hospitals. So please be aware of that. And please, if you are working at these facilities, please refrain from going to large group gatherings or multi-use facilities, including bars, PC cafes, singing rooms, and etc. And please remember that COVID-19 can spread at any venue under crowded, confined, and close contact environments. So we ask you to avoid club meetings, religious small group meetings, and other gatherings that take place in poorly ventilated and closed areas. And please practice hand washing, wearing a face mask, and physical distancing in your daily routine. Thank you very much. And also we have a cluster of infections in the social society, and we also have cases that are related to Ridgeway, linking to the worship centers as well as hospitals as well. And we are also seeing a surge in the number of people with chronic conditions. And a lot of the large-scale business establishments have been shut down due to the infections, and also the infections have have been spread to schools and kindergartens, and therefore a lot of students especially had to get tested. And during the weekend, we also advise you to be extra cautious, because if you have increase of physical contact, you could also be exposed to high risk of infection, which could also lead to a secondary or even tertiary infections. We have gone through many difficulties as we fight against the COVID-19. However, we also at the same time learned a lot about the virus. We learned that the COVID-19 spreads very fast under 3C conditions, which are crowded, confined, and close contact environments, which are frequented by people and at places where people have close contact within 1 meter. And I believe that the COVID-19 is effectively blocked when we wear face masks and wash our hands. And as we have controlled the exponential surge in the outbreak in Gyeongbuk and Daegu province, we ask you to stay vigilant going forward so that we can effectively fight the virus. So during this weekend, please refrain from going outdoors and have social gatherings, and please refrain from going to multi-use public facilities. And for religious centers, we also ask you to switch to online streaming of services, and please limit the number of participants if you meet face-to-face. Last but not least, for the elderly people with weak immune systems, please comply strictly with these quarantine measures and preventive measures. Thank you very much.
Right, there was Chung Eun-kyung, the head of KCDC, with Friday's afternoon briefing. So to give us a summary of the key announcements.
All right, Chung Eun-kyung mentioned that we have 56 new cases, out of which 43 were local infections and 13 imported cases from various countries. And if we break it down into the recent cluster infections in the metropolitan area, we have 1 new case related to a distribution center in Bucheon, 1 new case related to small church gatherings, and 1 at a sports facility, as well as 1 at an insurance company. So it looks like there have been just single-digit increases in many of these cluster infections, but the concern is related to the Richway door-to-door business, because that one has 23 new cases. That brings the total to 139, and another concern is that there are clusters from this cluster. So another cluster infection stemming from the door-to-door business at a church has also been occurred, and it looks like people aged 65 or older, there are 44.6% related to that case. So this is still a big concern, and which is why Chung stressed that social distancing is important this weekend, highlighting to refrain from attending small gatherings and also going to confined crowded places with poor ventilation, and especially for people with weak immune systems, which is mostly the elderly people. And she also mentioned the extension of the stricter measures in the metropolitan area that's been extended to past the 14th. So that's because the government assesses the situation due to the cluster infections is the result of lax abidement of citizens. So we should abide by the social distancing measures for the weekend.
All right, so thank you very much for that. We'll see you again on Monday.
See you on Monday.
Now, as our Kwon-soa mentioned, cluster infections remain a concern in the metropolitan area, as does the presence of asymptomatic carriers of COVID-19. In response to this reality, Seoul is offering free testing to all its residents and began by providing the service to students at a school here. We have details in this next report.
지금도 어디에선가 조용한 전파가 일어나고 있을지 모릅니다. 물류센터 외에 감염에 취약한 사업장이나 시설들을 찾아내서 선제적으로 조치를 해야 하겠습니다.
The Seoul City government decided to offer preemptive COVID-19 testing to individuals without symptoms amid a rise in asymptomatic cases. Schools began to reopen in South Korea from late May. The capital city has tested over 6,000 students in 62 dormitories since June 3rd as a preemptive move to prevent cluster infections. At this walk-through testing center set up at Haejae High School, preemptive testing is being provided to some 300 students living in the dormitory.
코로나가 이렇게 무증상 감염도 있다 해서 걱정도 많이 했었는데 이렇게 코로나 검사도 받고 검사 결과도 알게 되니까 안심하고 학교 생활을 할 수 있을 것 같아요.
선제적인 조치를 하게 된 것이 무엇보다 학교 생활을 안전하게 할 수 있게 된데 바람직하고 긍정적인 조치가 되지 않았나 하는 생각이 듭니다.
The city is working with 25 local public health centres to quickly isolate those who test positive at these testing centres. Preemptive testing has been also made available to the general public since June 8th. Anyone who wishes to get tested can apply online before visiting one of the 7 designated municipal hospitals for free testing. In addition to school dormitories, the city government plans to expand testing for other high-risk groups, including those in shanty towns, low-cost dormitory housing facilities, small construction sites, and traditional markets. With the pandemic showing no signs of abating, anticipation is high that the city's preemptive testing will be a proactive step in preventing the spread of the virus.
The pandemic persists, but preparations for a post-pandemic world are underway, and Korea, for its part, has unveiled its version of the New Deal as a future vision. Now, in this next corner, we connect live to an internationally acclaimed futurist, Gerard Leonard, to learn more about the industries that look to thrive after the pandemic. Welcome to the program, Mr. Leonard.
Hello, nice to be here.
Many are speaking of a new normal in all areas of society amid the pandemic. What does this phrase mean socially and economically, Mr. Leonard?
Well, basically, there's a time before Corona, and then there's a time after Corona, or with Corona, right? And the new normal is not going back to the old normal. So we're working from home, we're distancing, we're learning how to use technology. Some businesses will really suffer, like tourism, and other ones will explode. For example, obviously technology and healthcare. And so basically what we're seeing here is a radical shift. You know, I call this a great transformation. It really is not just a great recession, it's also a transformation into new ideas, new concepts, new ways of living.
Keeping that in mind, Mr. Leonard, what are some of the promising industries in the post-COVID-19 era?
Well, there are quite a few. You know, it's kind of astonishing to see that not everything is going down. You know, for example, technology is exploding. These days, I kind of summarize the current situation with big tech, big health, big state, right? And so we're going to see a lot more research. We're going to see trillions of dollars moving into healthcare, and of course, vaccine and therapeutics. And all, I mean, there's hundreds of thousands of high-level scientists working on solutions. Lots of industries there. We're going to see a huge uptake, of course, in climate change activities, which are the next big threat to humanity, you could say. The business of providing tech products, internet business, mobile business, all of the stuff, working from home, that's all rising. What is going to be difficult, of course, tourism, airlines, concerts, keynote speaking, conferences, and so on. But I think, generally speaking, we do also have opportunities. It's not just all a threat. You know.
Right. Korea, for its part, has secured global praise for its response to COVID-19, Mr. Leonard. What are some areas that it can focus on in the post-pandemic era to maintain this international acclaim, if you will?
Yes, Korea has done really well. I mean, as I just heard, of course, there's always ups and downs, right? But making testing available, clearly that's number one, right? And the citizens complying with the rules that have been stipulated. You know, I live in Switzerland where we do pretty much the same thing. So trust in government, right? That's something that I think really needs to happen. And it's also quite clear when you look globally that the countries that are most unequal, you know, that have a lot of inequality, like the US, UK, Brazil, right? They're doing the worst in the virus, right? Because they're not prepared to pull together, to put money in, to set priorities. And this is what South Korea has done, obviously, and continues to do. And I think this is the ticket for the future, is to find ways to collaborate, to actually put resources behind it. That's going to be crucial.
Now, you mentioned this yourself earlier. The pandemic has renewed interest in bio-related industries as well as those of health. How do you see these industries evolving in light of the COVID-19?
Well, I mean, we're seeing a global hyper-collaboration of scientists. And the whole concern about patents and keeping it to yourself, that's less important now. Now everybody's coming together, and of course the Bill Gates Foundation and many others are putting hundreds of millions behind it. The states are putting money in. I see the money moving out of, say, oil and gas, right, or even the military, into healthcare, into biotechnology, into, for example, CRISPR-Cas9 testing, and all those kind of things. I mean, we're going to see a huge boom there. That's going to be great for the global economy and also for people in that turf, quite clearly. And then, of course, education, teaching people how to deal with this. I mean, we're moving into a world where this is always going to be there, one way or the other. Right? It's just not going to go back to 2 years ago. We have to deal with that. It requires agility, and sometimes it requires pivoting. You know, coming up with a new concept of how we're going to do things.
All right, Mr. Leonard, thank you very much for sharing your thoughts with us live at this hour.
You're welcome.
제약과 생명공학 산업이 우리 경제를 이끌어갈 시대도 멀지 않았습니다. 코로나19를 우리나라 바이오헬스 산업 도약의 계기로 삼기로 하였습니다.
Korea's biohealth industry has garnered much global attention given its quality test kits and data-based response to COVID-19. So what needs to be done to keep this momentum? To answer that question, I have here in the studio Professor Che Soo-chan, the Vice Head of Planning and Budget at KAIST. Welcome to the program, Professor Cha.
Great to be here.
And I also have freelance journalist Morten Larsen from Denmark. Good to see you again, Morten.
Good to see you again as well.
Professor Che, we'll start with you. For the sake of clarity, perhaps we could begin with the definition of the term biohealth industry and what it includes.
When we say biohealth, it refers to industries that utilize knowledge from life science, medicine, and pharmacy. It includes new drug, medical device, and healthcare service industries.
And this industry looks very promising in the future.
Yes.
I see. Professor Che, COVID-19 is believed to have had a great impact on Korea's biohealth industry then. Tell us a bit more about this impact.
Well, if you look at the figures, the Korean export of the COVID-19 test kits in May was about $130 billion, while it was less than $1 million just 3 months ago. As far as the overall biohealth export is concerned, it has increased about 60% from a year ago to about $1.2 billion. The recognition of the Korean biohealth capabilities has opened up an opportunity for the Korean biohealth industry. Within Korea, the investment in biohealth industry has been growing, and this will be accelerated with this new opportunity.
So the numbers speak for themselves then?
Yes.
Morten, has there been a tangible shift in global perception of Korea's biohealth products?
I mean, yeah, definitely. You saw it in just the terms of the amount of countries contacting Korea to receive to ask questions about how they handle the service and or how they handle the crisis and how to gain some of these test kits. I mean, Denmark, where I'm from, had a bit of a scandal where they were offered test kits from Korea, but they didn't receive it, and the public was, because the Danish government was too slow at saying yes to the offer, and the Danish public was very upset about this because they missed out on Korean test kits. But we've seen this all over Europe, we see this in the US as well. A lot of people are talking about the Korean test kits. I, for example, got an email from my editors being like, oh, we've seen this new Korean test kit being approved by the EU. Like, what is this? What do you know about this? So there is definitely an increase in knowledge about Korean biomedical industry.
I see. Professor Che, I'd like to direct your attention now to Korea's efforts in creating a vaccine for COVID-19. How far have we come in the race to create a vaccine?
Currently, about let's say exactly 13 clinical trials have been approved by the Korean Ministry of Food and Drug Safety for therapeutics and vaccines for COVID-19. And the 12 of them are therapeutics and one is a vaccine. For comparison, in the US, 858 clinical trials have been approved, and about 825 are therapeutics. So at KAIST, we are doing pretty much what others are doing, working hard on identifying therapeutic and vaccine candidates. We have several teams working on various projects. One, for instance, is working on therapeutic and vaccine project that could be an effective tool not only against this current the COVID-19, but also broader viruses. Another team is working on using AI to introduce the X-ray based test, for instance. So we have several teams working in parallel.
I see, with current efforts, of course. Yes. That had been a question that Morten wanted to ask you earlier, right? We were talking about it.
Yeah, so we've seen as Korea is working on developing, but like China, the US, all these different nations are working on it. I know even Denmark has recently, there was a big headline with showing some promising results in mice, some of the tests they did for vaccines. But this development of a vaccine is not only in terms of promoting health, is also a part, at least when we're talking about the big two, China and the US, a part of a sort of controlling the narrative story. If they come out with the vaccine, they get a giant international boost in standings. And this creates some sort of competition more so than cooperation. And this competition, I'm wondering, how is this affecting the development of an effective development of a vaccine when generally these projects are big corporation projects?
Well, as you know, it takes a long time and a big financial resources to develop even a single drug, and it'll be the same with coming up with effective therapeutics and vaccines against the current COVID-19. So I would suggest that what we need is global collaboration. Of course, competition is useful, but I think given the difficulty of the task, I think the global collaboration would be more productive
than global competition.
Yes.
Right? Speaking of investments, like financial investments, you would need to come up with a vaccine or treatment. The Bill and Melinda Gates Foundation has been investing in a number of epidemic countermeasure research here in Korea. Do you believe such investment is tangible indication of perhaps a recognition of Korea's advancements in the biohealth industry?
I mean, having the name Bill and Melinda Gates Foundation behind you is a gigantic seal of approval in a way, because not only does that mean there's a lot of money behind it, but it also means you have one of the most outspoken people talking about the pandemic, talking about preparation and prevention of further pandemics in the future behind you as well. So it is undoubtedly a validation and sort of promotion of the Korean efforts to preventing further pandemics and the coronavirus pandemic as well.
Right. Professor Cha, I understand that you believe medical equipment and supplies have greater growth potential than drug development. Could you explain this for us?
Yes, before I go to that, let me mention just one more thing
of course,
on the global collaboration. The KAIST Center for Biohealthcare Innovation and Policy has been pursuing Korea's participation in the IMI, Innovative Medicines Initiative, which is a public-private partnership in Europe. Even before the current outbreak of COVID-19, and one project was for the superbacteria, which is another big problem for the mankind ahead. So coming to the medical device industry, it is, even though Korea showed some strength in COVID-19 test kits, it is fair to say that the overall, the Korean biohealth industry is not as advanced as its IT industry. But in medical device industry, Korea has better opportunity because it takes less time and resources to develop medical devices, and Korea has strong the technological capabilities, but it does not have access to the global distribution networks. As you know, that it is not easy to access doctors and hospitals because they are very conservative. So that's why I thought, even though in the long term we have to pursue the new drug industry, in the medium term the medical device industry would be a good,
a more feasible plan for now.
Right, good strategy, a good intermediate strategy in the overall biohealth strategy.
Professor Che, by definition, the fourth industrial revolution, it's believed to be the blurring of boundaries among the physical, digital, and biological worlds, a fusion, if you will, of advances in all areas, in quite a number of areas, including artificial intelligence and genetic engineering, and so on. How do you envision the conversion of biohealth and technology in light of COVID-19?
Well, it has already opened up many opportunities and many things we did not realize before. There is definitely opportunities for the AI applications in the biohealth area, like early warning for epidemics and tracking infected people with less privacy problems, and the identifying therapeutic and the vaccine the candidates, and no-contact medical services. And I've already mentioned the KAIST project on using the X-rays to test the COVID-19 virus, and this obviously requires it's the KAIST AI capabilities.
Of course. Morten, is there anything else that you'd like to ask Professor Che?
I mean, with something the corona epidemic has taught all of us, on whether it's good or bad is another question, is to use, I mean, we saw earlier today an interview via Skype, and I'm sure if you have students, they have already experienced having classrooms over Zoom and meetings over Zoom, and we've all had these sort of connections through a screen now. And moving into the health industry, it's called telemedicine, I believe, is, I would assume it's inevitable to grow, but as I also understand, it is a bit controversial here in Korea. So I'm wondering how that would play out in the long term here.
Well, the strongest opposition to telemedicine in Korea comes from doctors who provide healthcare services in local clinics. And what they are concerned is that with this telemedicine, the big hospitals would benefit more from this new way, and people would go more to the big hospitals than to local clinics. And one solution to this issue would be for Korea to strengthen the primary care services provided by local doctors.
I see. So addressing this concern, there is a possible solution.
Yes, because without resolving this sort of political issue, the telemedicine in Korea cannot be advanced.
I see, but hopefully it will be in the future. All right, Professor Che, thank you very much for your talk today. And Morten, as always, thank you for being with us.
Anytime.
And that brings us to the end of this week's coverage of COVID-19. Do join us again next Monday for more updates on the virus here and elsewhere around the world. In the meantime, do reach out to us through our social media accounts or our homepage, arirang.com. Have a safe weekend and do refrain from venturing into venues that raise your chances of infection.